talked about cranial nerves 5, 10, 11, 12 lesions, but we haven't talked about cranial nerve 7 lesions. Do you remember what is the function of cranial nerve 7? And then consequently, what would be the physical exam finding you would see, especially if this was a unilateral lesion? What you would see, remember, is that it's facial movement. So you would see unilateral facial paralysis. As you can see here on this side, the face is completely relaxed and drooping. It's called a facial droop. Okay, facial droop. There's many causes of cranial nerve 7 lesions. The most common one is called, the name is Bell's palsy, and it's due to reactivation of herpes simplex virus. Okay, this is, it usually has a gradual return of function, so the face will just normally get better by itself. Okay, there's other causes of cranial nerve 7 lesions, including Lyme, herpes zoster, and then tumor compression of the cranial nerve. Now, the thing to note is that you can have both lesions. Facial paralysis can be both central cause and peripheral cause. So peripheral would be the lower motor neuron lesion. This would be the cranial nerve. Okay, but you can have upper motor neuron lesions up in the motor cortex or anywhere on the track down. Okay, as we can see here, anywhere between the motor cortex and the facial nucleus. So let's go here actually. Motor cortex and facial nucleus, while the lower motor neuron would be anywhere along cranial nerve 7. So we need to understand these tracks first before we can talk about how to distinguish the two. Now we're going to look at a unilateral lesion, and first we're going to look at the upper forehead. I want to see that the upper forehead has innervated by both sides of the motor cortex. It's a bilateral motor cortex innervation. Okay, so forehead is bilateral cortex. On the other hand, the lower part of the face is only from the contralateral cortex. Okay, just gonna come here, and remember, just know that it's only contralateral. Okay, while the forehead is bilateral innervation. This is going to be key, so remember that. Now we're only looking at the left side of the face here. Now let's talk about lesions. We said, remember, so this right here is the facial nucleus. Okay, so an upper motor neuron is between the motor cortex and the facial nucleus. So let's say we cut here. You have an upper motor neuron lesion here. Well, let's see what happens. We just cut these two, so these two goes away. Now, the upper part of the face is not going to work. You see, it still has innervation from the other side of the head of the cortex. So the upper forehead still works, but we see that the lower part of the face does not work. Okay, and it's the contralateral face from the lesion that does not work. So we see that upper motor neuron lesion leads to forehead sparing, contralateral, lower weak. Okay, now we're going to take a look at lower motor neurons, and this is anywhere along cranial nerve 7, so past the facial nucleus. So let's do a cut right here. Lower motor neuron lesion, and then so if we cut there, we're going to take out this nerve, and we're going to take out this nerve. Okay, keep that cut. So is the top of the face going to work? No. Is the bottom of the face going to work? No. And this is all ipsilateral to the lesion, so it's going to be ipsilateral facial weakness. I apologize for my handwriting. I know it's very hard to read, but at least you can listen and understand. So this chart basically just says what I told you, which is that the lower motor neuron lesion has ipsilateral weakness, and it's both sides, so the forehead will be involved. the upper motor neuron lesion, on the other hand, because there's the bilateral cortex, the forehead, because it has bilateral cortex innervation, the forehead will be spared because it has the dual supply. So you cut off one side, but the other side is still working. So forehead sparing, okay? Forehead is not involved. And note that the contralateral side is affected because the lower face is innervated by the contralateral cortex. Alright, so that's it for cranial nerve 7 lesions and facial paralysis.